Hi everybody, and welcome to our module on dissociative disorders. Dissociation means a detachment from reality. The classic description of dissociation is for a patient to say they feel like they're outside their body. That patient has dissociated. In contrast with psychosis, patients who are dissociated still know what reality is. For example, they know that their body is sitting on a chair. They just feel like they are outside of it. In contrast, patients who are psychotic have lost touch with reality, so they are hearing voices and seeing things and they believe those things are real. So dissociation you can think of like a variant of psychosis where patients feel abnormal sensations, abnormal stimuli, but they know the difference between reality and what is not reality. The classic complaint from a patient with a dissociative disorder is to say they feel like they were outside their own body, or maybe they say they feel like objects in the room around them were unreal. Those are the type of things people with dissociative disorders will say. In an extreme case, the person may dissociate to such a significant degree that they become another person with a new name, age, and job, and we'll talk about this. This used to be called multiple personality disorders. Most dissociative disorders are associated with psychological trauma. They're a reaction to some type of major trauma in the person's life, maybe physical abuse, maybe sexual abuse, maybe the loss of a loved one, and probably dissociating allows the victim to cope with the trauma. Dissociative identity disorder was formerly called multiple personality disorder. This is a disorder that's more common in women, and it classically develops in a woman who has had significant childhood trauma or abuse, especially sexual abuse, often before the age of 6. So the idea here is that the woman takes on a different personality because she can't cope with the fact of living as the person who had that sexual abuse at such a young age. Patients with this disorder take on two or more distinct identities. They are called personality states with their own behavior, memory, or thinking. They are observed by others or reported by the patient. So an important point here, these patients are not psychotic. They know what reality is. They're not hearing voices that aren't there or seeing things that aren't there. They're not delusional. It's just that they have dissociated to such a degree that they have taken on a new personality. Some of these patients have gaps in memory about events that took place when they were in or out of a particular personality state, and the symptoms have to cause distress or problems in functioning in order to meet criteria for the disorder. And you may be aware that there are famous murder cases of women who pled not guilty to committing a murder because the murder was committed when they were in a different personality state, and that personality state was based on childhood sexual abuse. These are rare cases, but this just gives you an idea of the extremes that can occur in dissociative identity disorder. As you can imagine, because patients with this disorder were frequently abused as children, there's a high rate of occurrence with other psychiatric disorders. Up to 100% of patients with this disorder meet criteria for post-traumatic stress disorder. Up to 96% in some studies meet criteria for depression and substance abuse. There's also a high frequency of avoidant and borderline personality disorders. Moving on, let's talk about depersonalization derealization disorder. In this condition, as the name implies, patients suffer from symptoms of depersonalization and derealization. So let's talk about what those are. So depersonalization, the easiest way to think about this is it's a feeling as if you're detached from yourself. Some patients will say things like, I was in a dream, I felt like I was watching myself, I felt like I had lost control over my thoughts or actions, but it's called depersonalization because you are outside of yourself in some manner. Derealization is a feeling like you are detached from the surrounding world. And you can basically think of this as the objects in the world around you seeming unreal or foggy or visually distorted. Patients with derealization, it's not so much that they're outside their body, it's that the world around them seems strange. So patients with depersonalization derealization disorder will complain of these two symptoms. This disorder is classically triggered by some form of psychological trauma or overwhelming stress. For example, a patient who was physically or sexually assaulted will complain of depersonalization and derealization following that episode. Oftentimes it will get better with time, although sometimes it goes on to become chronic. In order to meet criteria for the diagnosis, the symptoms must cause significant distress and impairment, and in addition, reality testing must be intact. And I mentioned this earlier. Patients who are dissociating are different from patients with psychosis. In dissociation, patients are aware that the sensations they are experiencing are not real, and that is different from patients who are psychotic, who have lost touch with reality. We'll finish by talking about a special form of amnesia called dissociative amnesia. In this form of amnesia, the patient is unable to recall important autobiographical memories. So things like past events in their life, what their job is, where they live. This also, just like most of these dissociative disorders, follows major trauma or stress. So for example, once again, a patient who is physically or sexually assaulted may develop dissociative amnesia following the event. One thing that's different from this form of amnesia compared to others is it's potentially reversible. The memories may come back. For example, a person who has a brain tumor or a stroke and has amnesia usually does not recover those memories. That's not the case with dissociative amnesia. Another feature of this disorder is that the patient is usually not bothered by the lack of memory. So they're not sitting there complaining to you, I'm frustrated that I can't remember things. They are unaware of the things they can't remember. And then finally, in order to meet criteria for the diagnosis of dissociative amnesia, you can't have amnesia explained by another cause, for example, a medical illness or a brain injury. If this comes up in a board question, it's going to be someone who is under overwhelming stress and has experienced a psychological trauma. You can differentiate dissociative amnesia from simple amnesia because it involves large groups of memories like the person's name, job, and home. And then once again, it's not caused by illness or a brain condition, it's caused by overwhelming stress. You can also differentiate this from repression because in repression, a person represses a specific memory, for example, the memory of when they were assaulted as a child. In the case of dissociative amnesia, they are missing large swaths of autobiographical information, once again, like their name, job, or where they live. So a classic example is a woman attacked in an elevator. Following this, she does not recall her job, where she lives, other information about her life. Later on, the memories resurface. That woman suffered from dissociative amnesia triggered by the attack in the elevator. And lastly, we'll talk about a dissociative fugue. This is a subtype of dissociative amnesia. The word fugue is Latin for flight or flee. So patients who have a dissociated fugue will have dissociative amnesia and then will travel or wander in that dissociated state. So for example, I once took care of a patient who many years earlier had been fired from his job and had dissociated. He had then been found by his loved ones in another state working under a different name. Basically, he had completely forgotten who he was and where he lived, and he had gone somewhere else and taken up temporary residence and actually gotten a job with no recollection of his prior life. That patient had a severe dissociative fugue where he went into a dissociated state and actually traveled or wandered. Importantly, he wasn't psychotic. He was well aware of reality and what was around him. It's just that he had amnesia and did not recall that autobiographical information from his past life. And that concludes our video on dissociative disorders.